On this episode, we'll discuss the County Health Department with our Director of the Cole County Health Department, Dr. Marie Peoples. Speak about what's going on in the health department and things that are coming up in the future. In our Hype segment, we'll turn to discuss how young folks are involved in our community, making it a better place to live, work, and play. All this on today's episode. I'm Marc Ellinger, and this is Our County, Our Future. Welcome to Our County, Our Future. Today my guest is Dr. Marie Peoples, the Director of the Cole County Health Department. Marie, welcome to the show.
Thank you.
And congratulations on your doctorate.
Thank you very much.
We're very proud of you at the county, and you do a great job for folks. We really appreciate it.
Thank you.
Folks probably know a little bit about you from your service in other areas in the community, particularly with the Jefferson City School Board. But maybe you could tell folks a little bit how your path led to becoming the Director of the Health Department, because it's really a fascinating story.
Well, absolutely. My education background, my master's degree is in public health, so I've always been very interested in public health. Before that, I earned a master's degree in criminal justice. You wouldn't think the two add up together, but they really do. One of the things that I saw with the constituents that I worked with were a lot of the social inequities that is faced in most of the issues that we talk about with public health. Poverty, low immunization rates, access to health care, all of those sorts of things. So I started my public health career with the State Department of Health and Senior Services. I served for a little over 4 years as the Chief of Primary Care and Rural Health. And then this position came about, and it really was a dream come true, working within my own community.
And everybody knows we have a health department.
Absolutely.
But I think a lot of people don't know exactly what the county health department does versus what a state health department does. So maybe give our folks out there an idea of some of the things that the county health department does.
The county health department is really pretty grassroots. We serve 75,000 people because we are responsible for the entire county. But the county health department does all of those things, the school health fairs, immunization clinics. You can come in just for your general clinical concerns if you don't have a primary care physician. Then we do a lot of the environmental services as far as inspections of child care facilities, restaurants, lodging, nuisance complaints. We really have a wide range of services.
And I think a lot of people are probably unaware of how in-depth those services are and how much they impact everybody's day-to-day life in the county. And I guess the best example of that is the restaurant inspections,
Sure.
which really impact everybody on a day-to-day basis. And the county health department's been doing that for quite some time. And that's an aspect that I think a lot of people don't know a lot about, but that you oversee. Maybe you can explain to folks how that process kind of goes about in our county.
We have what we call high priority, medium priority, and low priority, and that depends on previous violations or how well restaurants have done. But regardless, even if there's been no violations, we get out to each of the restaurants, lodging and child care facilities, at least twice a year for the most part, as well as the school food programs, any summer feeding programs. And more than it being a regulatory or violation process, our number one job is to educate. If we see things that's not an automatic write somebody up, we want to teach restaurateurs and their staff how to prepare food, how to do all the chilling, the heating. There's a lot that goes into it, so we really try to provide an education.
And recently there's been some news about some of the E. coli issues that arise periodically in any community, but certainly we've had a couple of instances in Cole County. Can you discuss a little bit about how that comes to your attention through the monitoring process and ultimately the actions that the county health department takes?
Absolutely. That surveillance is really the bread and butter of the health department. We're the only agency, and as most county health departments are, that are responsible for that surveillance. We may get reports from individuals who simply aren't feeling well, and so we do testing. Those reports may come from hospitals or different local health care providers. They can come to us numerous ways. We then do a lot of food history investigation. We may do social contact investigations, see if the person's been around, if they're around an ill child, changing diapers, if they did a school visit. A lot goes into that. The testing is generally done at the hospital or whatever the clinical provider was the first time, and then we send secondary tests to the state health laboratory for duplication.
And I guess a lot of people don't realize that we have our own nurses that work for the county, and they offer a pretty broad range of services to our constituents.
They do everything from the immunizations to breast exams, pelvic exams, just to general child well-being and clinical checkups.
And a lot of that's focused on the low-income portion of our community. I mean, I think people that have insurance and have the means to pay tend to go to private providers, but we kind of serve as the court of last resort. I mean, we're the final line of protection in Cole County.
We are a safety net for people that don't have health care insurance or can't afford their premiums copays, and we're seeing more of that as our poverty rate increases. We don't want to necessarily be somebody's health care provider. We try to make those connections with health care providers to provide that continuum of care, and we partner a lot with our community health center.
And it's been a very difficult economic climate for the last several years. How's that impacted the health department's services, both from a delivery of services, but also from the volume of folks you see coming into the health department?
The volume is certainly higher. The population has shifted a wee bit. It's not necessarily those that are way under the federal poverty scale. It may be those right at the poverty or even over the federal poverty lines. We're seeing a lot more working class families that simply can't provide health care.
And it is a government service. I mean, we need to be clear about that. And there is some copay involved for many of our services. But ultimately, taxpayers are funding the service to the betterment of the community.
Absolutely. And people do pay for services. There really isn't anything free at the health department with the exception of STD testing. We do offer that free of charge because we want everybody to have that if that's needed. But the sliding scale fee is pretty minimal, anywhere from $5 to $30, and even that can be difficult for families to pay.
And we get a lot of grant funding.
We do.
And I think that's something people don't realize, how we're able to leverage our local resources, whether it's county tax dollars or even the co-payments we see, into grants from the state, from sometimes the federal government, and even from private entities.
We receive a lot of grant funding, and that really helps us do our community education, for example, our school health clinics. Without that, we may not be able to go into the schools and do a lot of the free immunizations that we provide. Usually that is from a grant.
And the school health clinics is a field that's really important in today's world, I think, because we see so many kids in school that are struggling on a day-to-day basis, and their families are struggling. Maybe you can explain a little bit about how that school clinic really works.
You know, thank goodness for school nurses. We coordinate with the school health nurses. We try to have everything be at the convenience of the schools. They are responsible for doing all the permission slips, whatnot. We send a lot of education home with each of the families on what the immunization may be or the safety precaution. The school health nurses really do the majority of the work as far as collecting all that, and then we set up in a gym or a cafeteria and we provide the service. And it may not be during school hours, might be after school, before school, and we're trying to expand more so that the student's family can also receive that service.
You know, I noticed throughout our discussion a lot of talk about cooperation.
Absolutely.
And I think that's really important, the way the health department cooperates, not just with the school nurses, not just with the restaurants and daycares, but also, and you mentioned earlier, the community health center, which offers another ability to impact a big portion of our citizenry.
Absolutely. Community Health Service, for people who don't know, it's located on Truman Boulevard, and they provide a great service. And it is more your traditional primary care as well as dental care. They've got some behavioral health care, some pain management, but they are a great partner to us.
And that's been a relatively recent occurrence, the Community Health Center in our community. It's a great thing. But the health department, the county health department's been around for many, many more years.
Since 1916.
There you go, 1916. And ultimately, the county health department fills in some of the gaps that there is no private or quasi-governmental role to fill. And we talked a little bit about the clinics at the schools with immunizations, but the immunizations all across the board are really a key component of what county health departments deliver that really no one else gets out and delivers.
They are, and our health department has very high immunization rates, but sadly Missouri ranks last at my last checking in immunization. So it's something that we work very hard with our other health departments, local providers, to really boost those immunization rates and get that education out there.
And why do you think Cole County has that higher rate compared to the rest of the state?
I think it's because we have some terrific nurses. Our nurses get on the phone, we write letters, we text people, we do all the reminding that we possibly can. And we take the viewpoint that parents want these services for their kids. We try to remember the barriers, whether it be the cost, whether it's transportation, whether it's the hours we're open. We really try to consider what can we do better to make it more convenient for parents to get these services for their kids.
There's an impression out there that with respect to immunizations that there is a requirement. You have to have an immunization. We read about that sometimes in the papers. Ultimately, the decision to get immunizations is really a voluntary one, even though it's recommended. Isn't that right?
It is voluntary. It's up to the parent.
And it's an important service, and it's an important service the county health department offers. Immunization is vital to the safety of our whole population, not just to those folks who get the immunizations. We're going to take a break. We're going to come back with Ken Hussey with our Young Professionals group, and then we'll rejoin Dr. Peoples in our third segment on Our County, Our Future.
Coming home can be hard if you're a veteran of Iraq or Afghanistan. You may feel like you're all alone. But you're not alone. At iava.org, your fellow vets are all around you. Join our free online community, get the resources you need, and connect to other vets who know where you're coming from. iava.org. We've got your back.
More than half of America's most important military decisions are made here. No, it's not the Pentagon or NORAD or the headquarters of Air Combat Command. It's the place that employs over 50% of our armed forces. It's where you work.
See you in a couple weeks.
So when your employees in the National Guard and Reserve need time off to serve, give them the freedom to protect ours.
Welcome back to Our County, Our Future. We're now in the What's the Hype segment, and I'm very pleased to have with me Ken Hussey, past president of Hype. Welcome to the show, Ken. Thanks for coming.
Thanks for having me, Mark.
We've talked about Hype in every one of our episodes. We've talked a little bit about what Hype is. We've talked a little bit about the internship program. I'd kind of like to talk with you a little bit about how Hype's getting involved in the community, helping the community out. And you've really been a spearhead of some of those programs, particularly the new program that's been going on around Jefferson City.
Yeah, one of the things about Hype, it's not just about getting young professionals together, it's about providing them opportunities to find other ways to get connected in the community. And so we do a number of things within the organization to introduce them to nonprofits that they can volunteer with, service agencies that need their support. And a new initiative this past spring was called Serve Jeff City. And Hype was a partner with a number of different agencies in the community, including the United Way, the YMCA, Parks and Recreation, Central Missouri Community Action. And the real idea behind that was what would happen if we got a few hundred volunteers to give a half day of service to the community? What are some ways that we can make a substantial impact and do something of significance in Jefferson City and Cole County that day?
And Serve Jeff City just occurred.
It did.
And I hope that maybe we can talk a little bit about it going forward. But it was really a great event that day. A lot of folks came out, and the amount of young folks that came out was really quite inspiring.
Yeah, we had over 300 volunteers give a few hours that morning. And really, we try to market it to the young professionals group. On the planning team, there was a number of young professionals involved with coordinating it. We did our best to target young professionals, to provide opportunities to get involved. And even beyond that, we saw a lot of young families that day getting involved. You know, we were planting in the tree wells downtown. We were planting trees on the greenway, cleaning up the streams in the creek, doing roundabout cleanup around the community, just picking up trash. And so throughout the day, you would see mom and dad and 1 or 2 or 3 small children doing a service project together. And so I think a lot of times when people think of young professionals, they just think, you know, young and just the one individual, but really HYPE and this event was also about engaging young families too and helping build that quality of place that they're looking for.
And I think it's unfortunate, but there's a stereotype that a lot of young people don't care about their community. They're more concerned about mercurial things, or for the younger folk, even younger folks, video games and things like that. That's really not the case. And HYPE, I think, because it's gotten so involved in the community, is a good example of how young people really are engaged in our community.
Yeah, and, you know, that is a bad stereotype, and sometimes that's just because the way we get involved or join or belong to things is different than how our parents or our grandparents did it. And so, you know, we as young people, I think a lot of times look for specific projects or events to get involved with, and maybe we don't join the club the same way as previous generations. And so Serve Jeff City was a great way for us to fulfill what the younger generation is seeking, and that's that one-time, you know, event and special events throughout the year that we can target and really harness that volunteer energy into making an impact in the community.
And it's also a great way to build bonds amongst each other. It's not only are young folks getting to meet each other, but they're getting to meet a lot of other folks in the community, which ultimately helps the entire community grow and thrive.
Yeah, and most definitely, and everybody can serve, and everybody can plant something or pick up some trash, and it doesn't matter your skill set or education level or place in life. And that's a really great opportunity to get a younger person working with an experienced professional or a retiree, doing something collectively together that improves the community, while at the same time building a relationship that may foster a mentorship or something much more long-term than that.
Serve Jeff City, what a great program. We're going to look to doing it again in the future.
We are. We've got lots of ideas, some meetings to come to plan some future events, but it was the first, but certainly not the last event.
Well, it's a great event. I'm really glad you've kind of spearheaded it, particularly for the young folks in this community. It's another example of what's the hype. There's a lot of great things going on with hype. Ken Hussey, thank you so much for joining us on the show today.
Thanks for having me, Mark.
And we'll be back with Dr. Marie Peoples on Our County, Our Future. Welcome back to Our County, Our Future. We're again joined by Dr. Marie Peoples, the Director of the Cole County Health Department. And Marie, before we took the break and went to the hype segment, we were talking a little bit about how the health department operates in the county and a lot of the programs that are offered. We're now kind of transitioning out of the school year into summertime, and that brings its own set of kind of unique situations and issues. And I'd like to kind of walk through a couple of those for folks out there to get an idea of some of the resources that are available and some of the issues that we're going to be faced with this summer. It's been a very, very warm springtime, which I notice even when I go out on my backyard and my deck, the mosquitoes are already out in force. And that's a big issue nowadays. Years ago, that was just an annoyance. Now with West Nile virus, it's become a big issue. And the health department really is front and center in combating mosquito-borne illnesses.
We are, which we refer to as a vector control. We do our vector control every year. Health department has done it for years. What that involves is trapping mosquitoes. We have about 135 sites across the county that we use gravid mosquito traps, which is just a trap. It has some air, pushes the little suckers right on in there, and then we trap them, and then we test them. We do that. There's things that people can do to reduce the likelihood of mosquito bites, and obviously that's clear any standing water in yards, bird baths, pools, whatever that may be. Wear light colors. Mosquitoes are attracted to dark colors. And if you go on our website, there's a lot of safety tips as far as that. This year, sadly, the state health department has cut all of the vector control testing, but it is very important for our county, and that's something that we're going to be able to continue doing. And it's something we've partnered with the city to continue doing.
And I think it's important to note that there are a lot of services that the county and the city cooperate on
Absolutely.
in the health department. And there are a lot of services that the county and the taxpayers pay for directly as opposed to getting money from the state and federal government.
There are, but this is an important service, and it was important to the city and us to continue doing it, so we will. And then the city has the spraying, and so it really works well if you know where your areas that may be likely for West Nile are at, and then of course the spraying.
And you also work with the public works departments. On our last
do.
show, we had the county and the city public works departments on. You work with both of those groups to work on
Yes.
mosquito spraying, right?
We do. Now, we don't have a tick surveillance program, but people, as summertime comes, ticks are out, and there's a lot of them, and there's a lot of tick-borne disease as well as mosquito-borne disease, so people need to take precautions in that area as well. Other issues over the summer, of course, would be heat-related illness, particularly for children and our senior populations, so certainly take care. Depending on temperatures, there may be cooling centers that are open, so people should always know what resources are available. And again, if anybody has questions, they can look on our website for that information.
And speaking of cooling centers, I think a lot of people probably don't understand what a cooling center is and how it's operated. Maybe you can talk a little bit about what's the criteria to stand up cooling centers and then how they work.
You know, it really depends on the temperature, humidity, and how they work is it is local organizations. Oftentimes it's faith-based organizations that open their doors to the community to come in to be cool. They also may have the fan giveaways, that sort of thing. But they are open to the community and encouraged to come. People don't realize for the most part how dangerous heat illness can be. And you may not realize it immediately that you're disoriented or that you're impacted, particularly amongst the elderly and children. But it is very serious, very dangerous.
And as the temperatures get hotter and we get farther into summer, we find more and more people nowadays that are indoors extensively, and that heat can really build up inside, and folks can not only get heat issues but dehydration issues. They go hand in hand.
Absolutely, and this is a concern every summer, but as we talked about a little bit as far as income and the economy, people are trying to save wherever they can, and particularly amongst our elderly. They may not turn their air on, they may not have a working window unit, so be a good neighbor. Check on your neighbors, check on your elderly relative if somebody hasn't showed up where they're supposed to or they haven't been at church, but definitely do your part and watch out.
And you mentioned the faith-based community, particularly with the cooling centers, but with a lot of other programs. The faith-based community is a really vital part of the service network that allows us to protect the health of our folks.
Particularly with emergency response. And sadly, we have a lot of need for emergency response. We kind of live in a tornado area, and we have had a lot of practice with Joplin. We have learned a lot from that incident. Health departments have been very involved, but our faith-based partners, they open their doors, they partner with us, they open triage. We've done a lot of mock tragedies, if you want to say that, but they help us be prepared.
And you talked a little bit about emergency services, and not to be confused with the ambulance service,
Yes.
which is a whole different
Yes.
entity. But, you know, we do a lot of emergency training, and I know you've been through emergency training. Give folks an idea out there what emergency training kind of entails from your perspective, because you've gone through it.
I have. The immersion where you're there for a full week or 2 weeks and going through all the drills, it's a lot. It is mind-boggling what community partners and all the different helping organizations, the services that they put up. And of course, it's to help community members. Maybe mental health needs, it may be the acute physical needs depending on what the emergency was, making sure all the supplies are there, making sure people are accounted for at all those registries. It really entails a lot. And then after you do that acute crisis, of course, it's the mitigation. What do you do after the crisis? How do you get people back into their homes or the structures?
And over the years, both since you've been with the health department and before, our county's been very active in planning for emergency response. In fact, when we had the potential flu outbreak a couple of years ago, we were actually a repository for a very large number of flu dosages here in case people needed the vaccine. I think that was a real positive thing that we could offer.
Absolutely.
That many other counties didn't have the luxury of offering.
I think that's right, and I think that goes back to not only the health department being prepared, but we have great agencies that we work with, both city and county, and our not-for-profit and faith-based organizations.
And we do partner with the state also when we need to.
Absolutely.
We don't want to forget the state
state.
government. and you know, one of the things the state helps us with is various types of grants to fund specific types of programs. Some of those grants are very small. Some of them are much larger. What are some of the grants that you've seen come through that have had real impact in our community, and where do you see that grant process going?
We're just wrapping up a small grant. It was only for $2,500. In the grant world, that's not a lot of money, but we did some really cool things with that grant. It was to bring awareness on violence towards women and girls, dating violence, partnered violence. And we were able to do some fun things. We did recordings with a lot of local teens, teachers, some principals, some health providers, just on positive messages. And then those recordings were then given to any faith-based or not-for-profit. Anybody can have one. If they want one, they can just contact the health department. But what they did is really frame messages so that teens would understand them. And it was teens giving messages to their peers, and it was fun. It really got that group that sometimes is hard to difficult to talk to, communicate about those issues. It really started some discussion. It also allowed us to do a poster contest for school-age youth. We did it for 9th through 12th grade. We had about 35 poster entries. The winner was a senior from Helias, Kayla Carroll. She did a phenomenal job. So, you know, it's $2,500, and we also printed a lot of brochures, educational things, and then, of course, distributed to the community. And when we receive grants, we really try to stock up on materials, and then all those go back to the community. We're not just purchasing things to keep there at the health department.
And grants don't fund the operation. They allow us to expand the operations. Our nurses are not contingent upon grants. It's the extra programs we're able to offer.
Thankfully, the county, we are one of the luckiest health departments. The county does subsidize most of our employees' salaries, and that's not the way it is across the other counties. They are reliant on grants. The grants that we receive very rarely go to salary. They really are for operations, for health promotion, and just getting awareness out on any emerging issues.
And speaking of emerging issues, as we go forward, what are some of the issues you anticipate seeing, not just during the summer, but a little more long-term in the county with respect to health issues?
You know, all over the nation right now, we're hearing about obesity epidemics. So certainly obesity, we're working more and more with the schools on fitness programs, gardening programs. We're doing an 8-week camp this summer with Boys and Girls Club. We're calling it Fit Kids Camp. And it's for youth ages 10 and up. Master Gardeners are partnering with it. Hy-Vee's been a great partner. They're donating a nutritionist to the camp. Walmart's been a good partner. Each successful youth that goes through the 8-week camp will receive a free bicycle. So we are doing lots of fun things, but that obesity certainly is an emerging issue. Just nutrition in general. As more and more families are experiencing poverty, it's difficult to eat healthy. All the immunizations, flu things, I could go on and on.
Well, and amazingly, we reached the end of the show. I would like you to give out contact information for folks that have questions about things we've discussed today, or maybe things we haven't talked about, and how to get a hold of the health department.
Absolutely. The health department is located at 1616 Industrial Drive. Our phone number is 573-636-2181, and then people are always welcome to go to our website, and it has email contact information on there.
And the website is?
Is colehealth.org.
colehealth.org. Marie, thank you so much
Thank
for coming
you.
on the show. We really appreciate it. And thanks for all the service you do to our community.
Thank you.
We've talked about our health, and we've talked about helping in the community. Ultimately, it's our community to take care of. For folks, as we go into the summer, watch out for your neighbors, watch out for your friends. Let's all try to work together to make sure that our friends, our family, our neighbors are safe, happy, and healthy during these warm summer months and as we progress into the school year. But also let's remember that getting together and working together, young folks and old folks, adults, children, every sector of our society, we have to work together to make Jefferson City and Cole County a better place to live. If we pick up behind ourselves and we pick up the streams, it's a better life for everyone. And ultimately, that's what we want. We want a better place to live, to work, to play. And together we can do that, because ultimately, it's our county, our future. Have a good day.